Hey, this is Dr. Kayla White, and today I'm going to be discussing myasthenia gravis. So looking at the description, myasthenia gravis is a chronic autoimmune neuromuscular disease that causes weakness in the skeletal muscles that worsens after periods of activity and improves after periods of rest. These muscles are responsible for functions involving breathing and moving parts of the body, including your arms and legs. Available treatments can control symptoms and often allow people to have a relatively high quality of life. Most individuals with the condition have a normal life expectancy. Myasthenia gravis is caused by an error in the transmission of nerve impulses to muscles. It occurs when normal communication between the nerves and muscles is interrupted at the neuromuscular junction, the place where the nerve cells connect with the muscles they control. So in myasthenia gravis, antibodies, immune proteins produced by the body's immune system, block, alter, or destroy the receptors for acetylcholine at the neuromuscular junction, which then prevents the muscle from contracting. So this is most often caused by antibodies to the acetylcholine receptor itself, but antibodies to other proteins, such as the muscle-specific kinase protein, also can impair transmission at the neuromuscular junction. Assessment findings for myasthenia gravis, you're going to see a muscle weakness that worsens after periods of activity and improves after periods of rest. Certain muscles, such as those that control eye and eyelid movement, facial expressions, chewing, talking, swallowing, often but not always involved in this disorder. You could see weakness of eye muscles, drooping of one or both eyelids, blurred or double vision, a change in facial expression, difficulty swallowing, shortness of breath, impaired speech, weakness in arms, hands, fingers, legs, and neck. Looking at the diagnostic methods, a physical and neurological examination, an Edgerfolmian test, blood tests such as acetylcholine in the blood, anti-MuSK antibody, as we talked about before, electrodiagnostics, so an EMG is considered the most sensitive test for myasthenia gravis. It's very helpful with diagnosing mild cases of myasthenia gravis when other tests fail to demonstrate any abnormalities. Diagnostic imaging, you could do a CT, MRI, it could identify the presence of a thymoma. Pulmonary function testing, you can measure the breathing strength, and that can help predict if respiration may fail, and it might lead to a myasthenic crisis. Treatments can include thymectomy, monoclonal antibody, anticholinesterase medications, immunosuppressive drugs, plasmapheresis, and intravenous immunoglobulin. Non-pharmacologic treatments can include plasmapheresis, intravenous immunoglobulin, and then a thymectomy.